Well, Vijay Limaye is a science fellow with the Natural Resources Defense Council in the US. He recently wrote a blog about the Harvard-based study on the correlation between COVID-19 and air pollution. He joins us live from Charlottesville, Virginia, via Skype. So this must be really important information for a lot of people. I mean, how many people live in places around the world deemed to have an unacceptable air quality standard, and what does this mean for them?
Absolutely. We're talking about millions of people around the world. It's estimated by scientists that more than 5 million people die early every year due to exposure to air pollution. And so that's especially concerning in light of the current pandemic situation, because we know that the same health problems that put people at risk of severe complications from COVID-19 are the same problems that are worsened by long-term exposure and short-term exposure to air pollution.
Hispanic and Black Americans are already being hit hardest by the coronavirus, and you've reported that the air pollution burden is also higher for them. Can you explain that?
Absolutely. We have seen in the United States a legacy of environmental injustice and systematic racism that has put pollution and people in a combination that has delivered an undue, disproportionate impact on communities of color and people living in poverty in this country. We know that people in those communities are more likely to be exposed to dangerous levels of air pollution, and we're unfortunately seeing the danger play out in the coronavirus death counts. In New York City, for example, the death rates amongst African Americans and Latinos are about twice the rate of death rates for white Americans, and similar patterns are emerging in other cities as well.
We are, of course, seeing short-term improvements right now in terms of air quality, but will that make a difference long-term?
Unfortunately not. The Harvard study identified the risks associated with long-term exposure to air pollution. And so any short-term gains that we might be seeing in terms of air quality are unlikely to outweigh the long-term health problems that are caused by exposure to air pollution in every country in the world.
I'm wondering, because there are so many factors at play when we talk about how susceptible someone is to coronavirus. I mean, whether they smoke, what their immune system is like, where they live. Did this study take into account all of those other factors? That must be very difficult to try and get a handle on.
Absolutely. The task of epidemiology is to really isolate cause and effect and account for all of those other factors you mentioned, like population density or pre-existing health status that might affect the relationship here. The researchers at Harvard did a terrific job of accounting for a lot of factors that could confound the relationship. And even after adjusting for all of those factors, they still found this very strong signal between exposure to air pollution and heightened risk of death from the coronavirus.
OK, so you're raising the alarm that air pollution makes people more at risk with coronavirus, presumably for other types of influenza and other coronaviruses as well. What's the likelihood, do you think, that governments, big organizations will listen and make a change long term?
I have hope that, we have plenty of evidence from epidemiology, decades of research that shows that there's really no safe level of air pollution and that we need to work hard to cut that pollution as much as we can. At the same time, we can address the climate crisis because the same primary sources of air pollution are the same problematic fossil fuels that are driving the climate crisis. So addressing the air pollution problem is really a win-win for public health and the environment.
I guess we do have a unique opportunity right now to look at how we want the future to be. We will have to leave it there for time. That's Vijay Limaye there, a science fellow with the Natural Resources Defense Council in the US.